Hi friends, if you've seen our videos before, welcome back, and if you're new here, welcome to our channel. I'm Abby, a registered nurse here at Blueprint, and I'm so excited to be helping you along in your journey to becoming a real deal registered nurse. As a registered nurse on a postpartum unit, your primary responsibility revolves around providing care to postpartum clients following birth to discharge, as well as healthy newborns. So what does a day in the life as a postpartum nurse look like? After arriving at the hospital, it's time to prepare for and start your shift. Depending on the unit, some hospitals have a specific postpartum unit that is separate from labor and delivery, but some are known as what's called LDRP. This stands for Labor, Delivery, Recovery, and Postpartum. This means that all care from the onset of labor until discharge is done in the same unit and typically the same room with the same staff. A postpartum unit is typically separated, and care provided there begins after labor and delivery. From there, it's time for huddle to receive your assignment and get report. Initial rounds will begin by checking on and assessing the postpartum client and newborn. Assessment of the postpartum client may include vital signs, pain level, fundal checks, bleeding, and incision site if the client had a cesarean section. Assessing postpartum clients carefully is incredibly important as complications can occur after birth. Nurses should monitor for things such as postpartum hemorrhage and provide appropriate interventions, including fundal massage and possible medication administration as ordered. Assessment of the newborn will include vital signs, feeding patterns, weight gain, signs of jaundice, etc. Postpartum nurses should be prepared to provide care and support to the infant to aid in the parent's transition during the initial postpartum phase. A large piece of working on a postpartum unit is education. Clients who choose to breastfeed, either with the newborn attached to the breast or by feeding pumped breast milk via bottle, may require education. Nurses can anticipate needing to provide education on positioning, latching techniques, and expectations with breastfeeding and formula feeding. Nurses can provide support, education, and address any concerns or challenges. Nurses can also educate on preparing formula, expected feeding amount and schedules, and choosing the best bottle for their newborn. Other areas of education include educating new parents on newborn care topics like bathing, car seat safety, umbilical cord care, safe sleep practices, and signs of illness. Depending on the mode of delivery, either vaginal or cesarean, and any complications, the postpartum client and newborn are typically discharged between 24 and 48 hours after delivery. Discharge planning prepares postpartum clients and newborns to go home, including arranging follow-up appointments and ensuring they understand discharge instructions. So you've discharged a client. Now what? You may receive a new admission of a new client. This will consist of admitting a new postpartum client and newborn from the labor and delivery unit. Initial assessments, documentation, and necessary procedures will need to be completed. These can include drawing blood for newborn screenings, administering newborn vaccinations, or conducting hearing screens. Throughout a shift, a postpartum nurse must be adaptable, compassionate, and skilled in medical care for both postpartum clients and newborns and client education. Postpartum nurses are an integral part of care for postpartum clients and their newborns during a critical period in their lives. Thanks so much for taking a peek at a day in the life of a postpartum nurse. If you have any questions or other topics you'd like to see covered in a video, please leave a comment below. See you next time.